I'm a fellowship trained breast surgical oncologist. I'm Dr. Amani Jambakar, and welcome to my October myth busting series, where I bust a different myth about breast cancer every single day of the month. Today's myth is that flat aesthetic closure like this is not an option for every body type. I've heard from many patients in my comments section who have said that they were told that with a larger body type, they would not be a good candidate for a flat aesthetic closure and that they should just choose reconstruction either with an implant or with their own tissue because flat aesthetic closure wasn't going to be right for them. Now, this patient here has had an excellent cosmetic outcome, which is why their photo is on the internet. But in order to achieve that, the surgeon did have to make both of these incisions one incision. And I've had to do that as well for patients who had very large breasts, because otherwise there would be too much excess tissue in the middle. And a challenge sometimes we have with flat aesthetic closure is not leaving excess tissue on the side, especially for someone who already has a roll there that kind of hangs out over the bra strap. But that doesn't mean that flat aesthetic closure isn't an option for every single body type. In that case, involving a plastic surgeon who can go around the back and resect the extra tissue is an important step to make sure that patients get a closure that they're happy with. Flat aesthetic closure is a valid type of closure after a mastectomy. And if you're talking to a breast surgical oncologist who doesn't recognize that it is or tells you that it's not an option for you, then you need to consult with someone else. Now, the caveat here is that I have seen patients who I've done a flat closure like this, and then they have decided that they wanted to lose weight. And after they lost weight, the dog ears, especially on the sides, were very noticeable. And then we had to do a small surgery to resect that so they were happy with it. And this goes for all types of reconstruction. If after the reconstruction you do decide you want to lose weight and you end up losing a lot of weight rapidly, then there could be some tweaks needed.